I have the pleasure of introducing our next speaker. His name is Dr. Ketan Patel, and he's the founder and partner of the Next Healthcare Technologies. Ketan Patel graduated from medical school in 1999 from the University of Toronto and worked in the ER trauma physician at Windsor's Hotel du Grace Hospital while opening up an ambulatory procedure clinic where he provided much needed minor surgeries, including pain management procedures, which led him to open a large integrated health facility in London, Ontario. Dr. Patel had a reset moment, which we'll hear about in his presentation today, that led him to pursue an interest in a number of game-changing technologies, which again you'll hear about shortly. He attended the prestigious Future Med program in 2013 at the Singularity University located in the NASA Research Park in Silicon Valley, where Dr. Patel was able to start delivering and delving deeper into the number of tech solutions for health informatics, medical devices, point-of-care diagnostics, and other emerging areas in healthcare. He is the founder, investor, and advisor and partner in a number of medtech startups, primarily in the areas of artificial medical intelligence and clinical decision systems, including a company that has set up here at TechTown. So Dr. Patel, there you are. And I did ask Dr. Patel just interesting fact about him. And he told me that, he's a serial entrepreneur in the medical sector, but in grade 8, he started a pizza company. And if you want to woo him later, because he is a judge, he likes greasy pizza. So Dr. Patel, welcome.
That was a fitting segue. I like your intro better than mine. I usually say I'm an unemployed bum as an advisor and investor. So if you can follow me around for the rest of the time. Fellow hackers, health pros, I have to pose you a simple and important question. What does it take to get you out of your comfortable shoes? To take the first barefooted step towards solving the biggest problems in healthcare? Think about that for a moment. It's going to be the theme of this talk. Ignition before blast off, before go. The first steps away from status quo are called many things, but I prefer to call them spark. And I'm not talking about the warm and fuzzies you're feeling right now because you've had a few drinks. Spark is the thrust inside of ourselves to start an adventure off, but more importantly, it helps us move forward. It gives us the directional confidence when you change course and you veer off into an unknown path with your startup. Think of spark as this tiny specks of light that has to fly mentally and emotionally before you can fly physically. Sparks can be exceptionally subtle, or they can be massively obvious. Whether you're an individual or a company, it may be something that stems from a frustration around a solution to a problem. But it can also be something very personally tragic, or it could be through the tragedy of others. But whatever it is at this moment, whatever it has been in the past, whatever it could be tomorrow, recognize it and embrace it. Ladies and gentlemen, it's my pleasure to be here to provide a glimpse of the story for my spark. But it's a simple story. It's basically finally seeing a solution presented that my mind could grasp. And if I can grasp it, it must be easy. It started with me falling through the sky. Now, I own the IP of this story, so I've taken some creative liberty. I didn't fall through the sky. I fall through the sky in a vivid dream, but it was close enough. I had a dream 3 years ago, and it was at the end of a terrifically mentally and physically challenging week in a pain clinic. We'd been slammed with a bunch of urgent referrals, and they're all very complex, but one stood out. And it was a pretty devastating situation of a young mother, 3 children, car accident, paralysis. I'm a little emotional about this story. Anyways, in chronic pain management, you have to understand that when we see a new patient, it takes us hours to review the chart. And even after you've spent those hours, you've only scratched the surface. Pain is extremely multidimensional. And I'd spent hours poring over her chart, and I had no idea what I was doing. So in my dream, at the end of the week, I was falling through a cloud. And it was a cloud of pages from her medical record. And it was extremely vivid. I remember falling initially through a cloud of papers that were randomly scattered, and all I saw were numbers and words. Words that I see every day, but without meaning. But pretty soon, I saw images. I saw what looked like ancient hieroglyphics, just symbols, icons, trends, timelines. I could make sense of data through an image. But that wasn't the really interesting part. The really interesting part came next. So I started to see more complex and exquisite geometric designs. I could see linkages between concepts. This is what we're really trying to figure out in medicine, the linkages. I could see linkages from her problems to her medications, to her social issues, to her social situation at home, where she lived, what her kids were like. And when I fell further, I saw something that I'm trying to recapture in my own companies. It's the idea of multiple pages coming together, forming a large, collaborative network. The thing I can only best describe as a huge and beautiful interactive canvas, with information moving around, which was alive and vibrant. It was my first chance to visually understand the connection between her lab tests, her drinking habits as a patient, the impact that it had on her liver, the impact it was having on her medications, how her genes and her medications interacted, and the symptoms and side effects that she was experiencing at the time. It was as if I'd seen a clearly detailed storyboard with very few or no words, things lined up in a snap. And it was easy to interpret when I saw pictures and images. As I was about to hit the ground, all I remember is a calm and intelligent voice that basically summed up her critical issues. For me, I awoke shaken and stirred by the idea, and it's a very simple idea. If we can interact with medical information the way I did in my dream, then we probably have a much better chance at understanding and treating our patients. So that was 3 years ago. I was frustrated about the way we were dealing with medical information in our records. I was pissed at how we wrote, typed, and dictated notes, spending hours doing so into electronic medical records, and despite doing that, we had no insights, and the insights we could have were far away. Today, we still do this. We spend valuable hours of our lives documenting information, but we do it without elegance, we do it without organization, without meaning, without that greater voice. But most importantly, we do that without consideration to the future generations that will inherit this data. So this dream resonated and haunted me for the next 2 years. I considered leaving practice on a daily basis. I spent 2 years trying to work with 3 different electronic medical record companies to change what they were doing, but it landed on deaf ears. After a lot of soul searching, looking at my bank account balance many times, I decided to retire. And today I personally pursue these technologies. We're trying to figure out a way to better organize clinical data. So we searched out, I found team members who were way smarter than I was, and we started a company. We're turning data into insights, insights into actions, and actions and interactions across many providers and patients into that beautifully unified voice that I heard. We're doing this in an attempt to really augment clinical intelligence. We're using the best emerging technology we can find. Really smart people, really smart companies, unsupervised machine deep learning, clinical decision automation, natural language processing. These are some of the technologies that underlie what we're working on. If it's related to healthcare data, we're tackling it. So where will this dream take us? We're not sure. We've just begun falling. And the end is nowhere in sight. But there is a hint. I know some of you are interested in this. We're heading into virtual worlds. Imagine a dream leads to the creation of a dream world, a virtual reality, that eventually goes back to the ability to interact with that original dream I had. It's very matrixy. I've chosen the right pill. So today, I'm part of a passionate team. We're blessed with the opportunity to do something really exciting. We're working essentially to form a new movement, something that's greater than ourselves. We've chosen to become health hackers. We've created a company with a direct focus on solving big health data problems. But there's a cautionary tale in this. To think that once you're sparked, every startup company that you're going to jump into is going to be a perfect joyride. That's an utter delusion. There are massive bumps, barriers, and obstacles in your way on this road ahead. If you forget your spark, the very trigger for change, you'll lose your grip on that sharp turn. And when things don't go planned, and believe me, they won't, you have to rely on your spark to get that energy back, to go for that next 1 mile uphill climb. You have to fixate on your spark. It's going to get you through those mundane business plan write-ups, the tiresome pitch competitions, no excuse, no offense, bubble bursting valuations by your angels, advisor rejections when you thought they would be the ideal person to join your team, the constant flutters in your stomach when you look at your bank balance and you know you don't have enough burn left in you. And then, of course, the failed critical demo call when you finally have a product and you had to make it go. But holding on to your spark and the vision of what can come next is going to get you through almost anything. This weekend is about igniting, blasting off, and going places that you've only fantasized about. Think about your frustrations, your problems, tragedies, blocks, and passions. Bring them. Find others in this room who are going to feel that spark with you. Look around, we're amongst the most accomplished, talented, and caring individuals. And they wouldn't be here if healthcare didn't matter to them. So this weekend should be about sharing spark, bringing your extraordinary game to this table. We'd love to hear about it. We'd love to hear about the passions and frustrations and tragedies and the wins and losses, because these are the things that drive innovation. Ladies and gentlemen, I'm in a room with my team. The Next Healthcare team is here, and they're in free fall with me. We have Andrew, Adam, Chris, Samantha, Melissa, Jason, Josh, and Simon. If you've been lucky enough to find your spark, find one of us and share it. We're all wearing these goofy white pins. If you haven't found your spark, let's raise a glass, or a bottle, or a fist, and hope that this weekend you'll find it. To Hacking Health. Thank you.